So my name's Kerryn Dillon. I'm a director in the Melbourne team of PwC. I work in our health and wellbeing team, focusing specifically on aged care in the health workforce. At the core of this community care sector, it sits across three segments: aged care, disability and childcare. These sectors span a number of policy portfolios: education, social services, health, housing and employment. There are so many people across Australia who need care from each of these segments. For example, in Australia in 2021, Australia's population aged over 60 was 5.7 million, and 22% of this population has accessed some form of aged care services. For NDIS, the Australian population has 1 in 6 people living with a disability of some sort. Approximately 10% of these access specialised disability services through the NDIS, but clearly there is more need. And lastly, in childcare, there is 1.6 million children aged under 5 in Australia, and 1.3 million of these actually access childcare services. There are many similarities in operations and workforce across aged, disability and childcare, these roles having significant overlap in terms of the duties that are required. Typical care role will include a wide range of support options, including personal care, support with activities of daily living, social connection, education and vocational support. So the demand on care services across the country will only continue to grow. There are essentially 4 key challenges facing the supply of care workers across the country. The first is the increasing demand for services. So with Australia's growing and ageing population, there is growing complexity and acuity of care required, as well as more people requiring care. The second challenge is the ageing workforce. So across some key domains for care, including nurses and aged care workers, there are high proportions of workers expected to reach retirement age, and there's not the proportion of population coming through at the other end to support the growth of the workforce required. The third is limited training, and across the care industry, like many service industry, typically the focus has been on recruitment and attraction of new students coming through, which has often been to the detriment of ongoing support for people who are currently in the sector. There's also a big focus on quality assurance and compliance as opposed to best practice in some cases. And lastly, there's a poor value proposition, as we've been seeing in the media recently, around wages and working conditions for staff. It's really difficult to attract new workers into this sector where the value proposition is so low.
My name is Frances McMurtry. I'm a Senior Manager with Strategy and at PricewaterhouseCoopers. I'm a registered psychologist and I focus in organisational design and performance, particularly in the care sector. We've done a lot of work in applying a demand and supply model to the care workforce shortage issue. In terms of demand, there's a range of different factors that could change the level of demand for the services across Australia, but frankly, that's not what we're trying to do. We're not trying to decrease the amount of care that people want across Australia. We're trying to increase the supply of workers. And so the supply factors are quite interesting. The first one is motivation. So what is it about care work that makes it appealing for people to come and do with their career? Once you've got a group of people who want to do the work, what are the training requirements or barriers to entry? How do you make it so it's easy to get trained up and skilled as a care worker? Once you're at that point, the third factor is around finding those people, so recruitment pathways and channels. How do you make sure that people are able to connect with the jobs where they need them? And then once they're in the job, the last lever is around retention. So how do you actually keep them there? How do you give them a meaningful career for the long term? Training and recruitment is often the first place people start when they're thinking about improving the supply of care workers. But our research found that actually the interventions have to start a lot earlier than that. So when you look at the working population across Australia, there's around 16 million people who are at the working age. However, there's only 13 million of those people actually in the labour force, because you've got people taking leave out of work, you've got people who are retired, on pensions, that kind of thing. Of that 13 million, there's probably only about 1 million people at best working in the care sector. And so if you're focusing investment on recruitment and training, you're missing a huge part of the talent pool who are not already in the care sector. That 13 million to 1 million, that's a big drop off. So what we found in our research is that a lot of the investment is already going into that narrow end of the supply chain, where you're focusing on Lots of recruitment investments, lots of training, and quite a bit around retention and keeping people there. And those are all really important and good. But where there's a lack of investment is in that motivation factor. How do we get more of the 13 million people to be interested in care work in the first place? And how do you get some of those people that are in the 16 million who are not currently in the workforce to participate and contribute to the care sector? The existing investments in the motivation factor already are going in the right direction. So there's a lot of emphasis at the moment around communication campaigns, and you might have seen lots of big, interesting ad campaigns selling the benefits of joining the care workforce. Those are necessary and important, but the challenge with them is that they are sticking to the existing value proposition of care work, which relies heavily on altruism. That's not going to cut it for a lot of people. We need to broaden and think differently about what care work is in order to reach new talent pools. In order to reimagine how care work is done, we've taken a pretty broad look at it, trying not to leave anything on the table in our analysis. And what we thought was, care work is always going to be interpersonal. It's going to rely on person-to-person connection and providing that support, often in the home, also in facilities and out there in the community. That has to stay, absolutely. But are there other things that can be done to augment that role so the demand for trained care workers in those specialised skills decreases and we can tap into different talent pools? So one of the areas that we thought about was fiscal policy. There's already a range of measures in place to entice people who are, or encourage people who are in receiving a pension to be able to participate in the workforce. So we could connect those fiscal policy incentives to the care workforce and actually incentivise people to contribute and be part of it. We could also look at things around HEX debt, that kind of thing, to encourage people to actually get on board and help out. Another area that we looked at was the share economy. So there's arguably a bit of a latent workforce in the share economy, and there's things that happen in care work that maybe could be outsourced with appropriate micro-credentialing or other quality and safety control factors. Things like picking up the groceries, taking people to their doctor's appointments, connecting them to social activities. I think it's a really exciting area that we could explore. Another area that we've looked into is the role of technology in building out that supply of the care workforce. A couple of things that we've thought about is virtual care. Obviously through COVID, virtual healthcare has become almost mainstream, and we see big opportunities for that in the care workforce. Things like connecting people to support workers for social support over the internet, connecting young people up to online gaming, that kind of thing, where there would be an opportunity to make social connections, perhaps not right in person all of the time. Again, not replacing the actual face-to-face support that has to be there as well. This is all around augmentation and supplementation. Another area that we've thought about is borrowing lessons from other industries that have had workforce shortages for a lot longer. Things like retail, mining, hospitality. A lot of those sectors have moved into investing heavily into robotics to take care of kind of high repetition, kind of labour intensive parts of the job. Now obviously that's a lot more complicated in the care sector. However, there are parts of the job where already the technology exists around robots that support you in the kitchen, in the garden, in cleaning, all those kinds of things. How can that augment the role of care workers? And I think as we think about technology, it's really critical to be thinking about the sustainability of carers in general. There can be a bit of an over-reliance of family and friends in providing care, and obviously that is something people will want to do for their loved ones, but it's not enough to meet the need for care workers across Australia.
Technology is actually going to be a significant enabler of this sector going forward. We're seeing a real appetite for investment in technology across providers, albeit with the pressures of funding that's currently impacting providers. Technology is really going to be able to support the aged care, disability and childcare workforce to provide better care so that they have greater access to information in a timely manner, which ultimately will result in better quality care for the client, the resident and the child at the other end.